We are going to begin a discussion of the respiratory system now, and we're going to start with some common terms. I have more terms than this in your notes, but these are some ones that I want to make sure that you know going forward. Apnea is temporary cessation of breathing. You do this every single night when you go to bed. Some point during your sleep, you skip a breath. Uh, it's completely normal. Now, what is not normal is if you find yourself waking up going like that. That is a different kind of apnea, and you probably want to have that checked out. Asphyxia just means oxygen starvation. Now, this can mean that there's not enough oxygen in the air, or it can mean that there's some sort of interference with respiration. So, an example, and by the way, this is not necessarily monitored. There's a famous case at NASA where they had some tanks that were filled with nitrogen. Now, nitrogen is all around you anyway. In fact, most of the atmosphere is nitrogen. And so somebody went into this tank for whatever reason and passed out. Their brain was monitoring the fact that they were getting rid of carbon dioxide like they were supposed to. So they weren't alerted to the fact, from a conscious standpoint, that their oxygen levels were dropping. There was no oxygen in the air, but their lungs were moving normally. Now, their brain was aware of the fact the oxygen levels were dropping, or at least the autonomic part of the brain was. So the respiratory rate increased. However, they weren't consciously aware of it. And so the guy passed out. So the next guy comes by, and this is NASA, home of heroes, right? There's a man down in a tank, so he runs in to help him, and he too passes out. Next guy comes along. Oh, look, guys are down in the tank, so he runs in to help. And he too passes out. And so did the next guy, and the next guy, and the next guy. It wasn't until the seventh or eighth person came along that they said, there's a whole pile of people in that tank. I'm not going in that tank. And just an example of asphyxia. Another example would be if people that try to commit suicide by turning their car on in a closed garage. And of course, what's happening is carbon monoxide is binding to the hemoglobin so that oxygen cannot, and carbon monoxide is binding irreversibly. And it's the same kind of a deal. Your body knows that you're oxygen starved, but conscious brain only begins to alert you if carbon dioxide is building up. And so they either expire or they're rescued after they have brain damage, is generally how that goes. Now, this is different from suffocation. Suffocation is blockage at any part of the respiratory pathway. So this is sometimes used at levels far away from what you would consider the respiratory system. For example, cyanide will mess up oxygen use in the cells, and sometimes that's called cellular suffocation. Okay, a couple of diseases that I want to make sure that you understand the difference between. The common cold and influenza and COVID-19 are all viruses, which means that antibiotics have no effect on them. So, unfortunately, people will sometimes save antibiotics that they're prescribed and self-prescribe them. And so they'll have like a cold or something like that. They'll take antibiotics and they'll think that it had an effect, but it did not. It had no effect at all on the virus. And instead, they just selected for antibiotic-resistant bacteria. We covered that in another lecture. Diphtheria is bacterial, which means antibiotic works on it. But what it does is cause an inflammation in the pharynx and larynx. Now, the pharynx is like the back of your throat. Inflammation there is called pharyngitis. And for adults, it's serious, but for children, it's life-threatening because they've got so much less space back there. When they have pharyngitis, it can shut off their windpipe. So we vaccinate for diphtheria. It's part of our DPT, diphtheria, pertussis, tetanus, that schools require children to have before coming because it's highly infectious. Emphysema is a chronic and irreversible damage to the alveoli of the lungs at the very, very bottom part where air exchange takes place. It causes overexpansion and rupture. So if this is your normal alveoli, then this is what it looks like with emphysema. And what happens is you have a lot less surface area for gas exchange. And so whereas if I checked your oxygen saturation right now, it would probably be 98, 99, 100, something like that. With emphysema, there are probably people walking around at the VA with maybe a blood sat of like 50 or something like that. And if I magically gave you that level, you would not believe how cruddy you feel. You couldn't get up and walk to the door without stopping to catch your breath. Pneumothorax is a collapsed lung due to air leakage into the space between the lung and the chest wall. The lungs require that there be a completely tight seal so that when the diaphragm drops, so it would be actually like that, it creates suction, allowing air to come down the trachea. If you've got a hole in the wall, when the diaphragm drops and creates suction, it's a lot easier for air to come into a hole and fill this cavity than it is for air to come down the trachea. And it doesn't help your lung out because your lung's sealed here, so that when air comes into this hole, the lung just collapses. Now, there are two ways that this can work. Surrounding the lungs, you've got this membrane called the pleura, and it actually folds in and has two different names. When it's right up against the lung, it's called the visceral pleura, and then as it loops around the outside, it's called the parietal pleura. But it is very slick, and it allows your lungs just to slide easily across your chest wall because they're actually sliding across this slick pleura. If this pleura becomes inflamed, it's called pleurisy. And if you've ever had it, you know you've got it because it feels like somebody is stabbing you every time you take a breath. In fact, people have even gone into the hospital thinking they're having a heart attack. The easy check for that is just hold your breath. If you have pleurisy and you hold your breath, it's not going to hurt at all because there won't be any lung movement. If you have a heart attack and you hold your breath, it's going to hurt worse because what's causing the pain is the ischemia of the myocardial tissue, and you holding your breath just made it worse. It's more common in the winter time, particularly in the winter if you're taking any kind of a drying agent like an antihistamine. You can get this. The treatment's pretty simple. It's 2 aspirin every 4 hours for a day with lots of water, and that generally can fix it. Another thing I wanted to show you here is that the lungs are separated into two cavities by a structure in the center. It's actually a bunch of things, but collectively it's called the mediastinum. And that means the lungs are in separate cavities so that if one lung collapses, the other lung is not affected. And that's very fortunate because if you collapse both lungs, of course, you're not getting any air exchange. And you can live on one lung. You can stay alive on just one lung. Okay, so this pneumothorax can happen two different ways. You can penetrate the chest wall, gunshot, knife, stab, something like that. That is called a parietal pneumothorax. And the way they fix that is they'll go into the upper chest wall. Well, of course, they'll seal the hole, but then you go into the upper chest with a chest tube and you just apply suction, and the lung pops back into shape. The second kind is a overinflation, or it can be due to trauma, but overinflation is fairly common, especially with very small babies or children, something like that. If you're having to inflate the lungs for them, you can overinflate the lung and actually cause a blowout, more or less. And the lung will then collapse if that's the case. Now, when a lung collapses, the heart tends to move towards that side, and the heart is actually somewhat suspended. Well, just excuse me.